Now I would like to invite Dr. Mohammad Ashikur Rahman Talukdar.
Sir, sorry to interrupt. That was a wrong biography. Actually, that was my co-author's name, and actually my name is not there.
Your name?
Mubin ibn Maqbul.
Your name, let me correct it. Yes, your name is Mobin Ibn Maqbul.
Yes, sir.
So your biography is not here.
Yes,
So
sir.
please introduce yourself briefly and deliver your talk on integrating digital health in rapid management of stroke patients in Bangladesh. So, Mr. Mobin Ibn Maqbul, it is your turn, and please complete your talk by 15 minutes.
Thank you, sir. I am Mubin ibn Maqbul. I'm a third-year medical student at Dhaka Medical College Hospital. And
Excellent.
my research interests currently include vascular neurosurgery and functional neurosurgery. I'm working as a research assistant there. So my topic of presentation, okay, thank you. So my topic of presentation today is integrating digital health in rapid management of stroke patients in Bangladesh. So a very good afternoon from my institution, Dhaka Medical College Hospital. And I will start my presentation with a very saddening slide. All these 6 patients were admitted in Dhaka Medical College Hospital, and within a gap of few months, all these patients died. Interestingly, all of these 6 patients was from the same family. And as you all have seen the title of my presentation, so I think you have already guessed what's the disease behind it. Actually, it was a stroke, a very common disease to us and very known disease to us. So what is stroke? Actually, it's a disease of the blood vessels of the brain, where the blood vessels of the brain gets blocked or narrowed either by fat deposition or cholesterol deposition, or by calcium deposition, or in plaque formation. And we already know that the brain is very susceptible, very vulnerable to hypoxia or lack of blood supply or oxygen supply. So when there's a narrowing of a blood vessel, the area of that brain dies immediately, and that may cause you death or lifetime paralysis. There is another mechanism of a stroke, which is seen in 20% of the cases, that is called hemorrhagic stroke. Due to hypertension or high blood pressure, the blood vessels of the brain got burst, and that leads to massive hemorrhage, and that can also cause you a stroke. That means there are 2 types of a stroke. First one is ischemic, where is the narrowing of blood vessel, which is in 80% of the cases, and the another one is hemorrhagic stroke, which is seen in 20% of the cases. So what is stroke? In stroke, in every minute, 2 million brain cells dies. That means every minute, 2 million brain cells dies in that area. And the resulting is permanent brain damage or paralysis of a limb and lifetime disability or death. And when a stroke patient comes to us, if we see the CT scan looks like the left image, and the rest 2 images on the right side are some post-mortem images. The middle one is an image of ischemic stroke, where the brain cells died and it caused a huge hollow in the post-mortem brain. And the third one is an hemorrhagic stroke, where there is a lot of hemorrhage and the brain ultimately damaged and the patient also died. If we see in our data, in our epidemiological studies published very recently in 2022, it is currently the 3rd leading cause of death in Bangladesh and 2nd leading cause of disability after accidents. What does it mean? We already know that there are some non-communicable diseases like diabetes mellitus, cancer, stroke, heart attack. These are the increasing disease, and less number of people are dying from the previous known dangers like tuberculosis, cholera, diarrhea. More people are dying from these non-communicable diseases. We all know about heart attack, but very few people of the country still knows about stroke. So if I simplify it, it can be a brain attack, you can say. And it is kind of the 3rd leading cause of death. It is more severe than even heart attack. Your heart can tolerate oxygen lacking or hypoxia more than a brain. And after road accident, if you see the cause of disability in Bangladesh, stroke is the 2nd leading cause of death. And our stroke epidemiology is similar to India, but slightly higher than Sri Lanka, but much lower in Pakistan. But this is a very interesting slide as published by WHO. WHO estimates by 2050, 80% stroke deaths would occur in median and lower income country. There's a question to ponder over. Why 80% death will occur in median and low income country? If a stroke occurs all over the world, why 80% should occur in median and low income country? That's a big question. Actually, there's a game changer. There's a drug, we call it Altiplase, which is a clot buster, you can say, or thrombolytic drug. What does it do? When there is a clot from the brain, the drug immediately dissolves the clot and the patient survives. So when the people in the other countries, in the higher income countries, already know the signs and symptoms of stroke, when they see my arm is not working, or I'm having some sort of paraplegia, hemiplegia, or I'm having some speech difficulties, or my face has been drooped in one side, actually I'm having a stroke. They immediately call to 999 or their emergency hotline. They get helicopter evacuation, and they get immediately injected the drug Altiplase, and they get cured. The thing is, in Bangladesh, we also have the drug Altiplase, but we cannot inject that properly. The reason is there's a time limit on up to which you can inject the drug. That is 4.5 hours. From the symptom onset, you have only 4.5 hours in your hand to inject that drug. And in Bangladesh, the majority of the patient comes after 3 days or 4 days. And when they come, it is not an ideal time to inject the drug. So the patient has his lifetime disability or paralysis. This is the drug Altiplase. You have only 4.5 hours to inject the drug from stroke symptom onset. But in Bangladesh, most of the patient goes beyond this time limit. In our experience in Dhaka Medical, around 3 or 4 days after they come, when we have nothing to do, just go for palliative care and go get some home treatments. And it is the globally consensus, even as supported by the American Heart Association, that you have only 4.5 hours for the treatment of stroke. That means rapid diagnosis and rapid treatment is the crucial factor or game changer in stroke treatment. So, so what they do, they all know about this fast F for facial weakness, A for arm weakness, S for speech problems. And when all they have these 3 symptoms or signs, they immediately call 999. But we have that lack of awareness, the lack of knowledge in people, so that they make the delay and they do not know what to go. For example, if I have such symptoms, I may go to the nearby community clinic in rural areas or Upazila Health Complex. But that Upazila Health Complex may not have that CT scan facility. So what they do, they get referred to the district hospital. So in this period, every minute counts. We call it time is brain. You have only 4.5 hours, but through this delay, you are losing around 2 million cells per minute. So that's the thing we need. That means there is a big referral delay. So if we can early diagnose and decrease the referral delay, we can save a lot of patients in Bangladesh. And the data shows us that 1 in 4 people worldwide over the age 25 will have a stroke. Previously, it was 1 in 6 people, but the recent data, as published by the American Heart Association, it is 1 in 4 people. That means all the conference members who are sitting here, at least 2 or 3 will have a stroke in his lifetime, but we do not know when. So to mitigate this gap or to elevate this problem, with collaboration with BOET and Dhaka Medical College, we have developed a new application to do the rapid diagnosis and triage of patients in Bangladesh. What does the app do? This is the QR code of the app, and there's the link. If you are interested, you can go there and try this application. It has a stroke probability calculator. Before it, I'd like to clarify what was the basic guideline, because in medical science, we always should follow an internationally recognized guideline because we are applying it to patients. The total, the basic guideline or basic algorithm of the app was based on the American Heart Association's FASTED app, This app has been used by paramedics in the United States. We have modified this application around based on our needs and our patient demographic data in and totally in Bengali language, so that even rural people in Bangladesh can use it. And the recent demographic data, recent epidemiological studies have found rural people are having more stroke but getting less treatment. But in city, they're getting more treatment compared to the rural one. So we have made totally the app in Bengali so that all people can use it. If you go with the app, you will see some questions. For example, কত ঘন্টা ধরে সমস্যা শুরু হয়েছে? For how long you were facing the problem? রোগী কত ঘন্টা পূর্বে সুস্থ দেখেছিলেন? Then the question is, রোগী হাত নাড়াতে কোনো দুর্বলতা পাচ্ছে কি বা আছে কি? That means it's meaning the arm weakness. Then তার চেহারায় কোনো অস্বাভাবিকতা আছে কিনা? That means facial weakness. রোগী কথা বলতে পারছে কিনা? If he has in his speech disturbance, then whether he or she can raise his arms, রোগীকে দুই আঙ্গুল দেখাতে বলুন, সে দেখাতে পারছে কিনা? রোগী এক চোখ বেঁকে গেছে কি? So based on the on clinical signs and symptoms, we can diagnose a stroke, and it has showing the result stroke is showing 85%. That means the global consensus in a stroke diagnosis is totally clinical diagnosis. No imaging, no nothing else. First, you should go with the clinical symptoms. If the symptoms should tell you there is already global established scoring system based on the symptoms, whether you have a stroke or not. Once the patient is diagnosed with a stroke, the application will track his or her GPS location to the nearest stroke center. For example, we already know that which hospitals have stroke facilities and which hospital doesn't. He may not go to another hospital where there is no CT scan facility, no stroke facility, and it will make the referral delay. But we already pre-program, and we already know which of his nearest center has that service. We can easily lessen or decrease the referral delay and can make an early diagnosis and rapid treatment of the patient, which can be a game changer in a stroke treatment in Bangladesh perspective. It will also have a knowledge library on how to prevent stroke and what is the treatment and what actual details about and what is the life of the stroke and how to deal with it. The public awareness is very much low in Bangladesh in a stroke. We all know about heart attack and this, but only a few people, if we do a survey, we will see a very less number of people actually are aware of the symptoms or signs. So we need massive public awareness. So we integrated a knowledge library in the application, so more people get aware. As I have mentioned, 1 in 4 people will have a stroke in lifetime. If we can install all of us in our mobile phone and can know when I'm having a stroke, we can easily get treatment, and this application can be game changer in Bangladesh perspective. We have a lesson from diarrhea. We all know that nobody now dies from diarrhea. When we have diarrhea, we take saline. That's called public awareness. What we have done in public awareness sector, people already know that, and they get treatment. We need similar type of awareness in a stroke too. So the key outcomes of the app are identifying a stroke signs early can lead to rapid triage. Knowing proper stroke center will prevent referral delay. The knowledge library will foster public awareness. And we have a plan to disseminate the app till Upazila level. And I would like to mention that this year's motto of a stroke day, which was in 29 October, we launched this application in Dhaka Medical College premise. The motto was, learn the science, say it's a stroke, save precious time. If I translate in Bengali, it will be, apni stroke ke janun, apni bolun it is stroke, ebong mulloban shomoy bachan. And we do not have a lot of facilities. We do not have helicopter evacuation like United States, but we all have a mobile phone. A mobile phone can be a game changer from this paralyzed person to this person when a person is running with his family members happily. So with a mobile phone, we can make a big difference in a person from a wheelchair to a person with happily enjoying his time with his family. And I would like to thank to my team members. I'm from Dhaka Medical, and the middle 2 persons are from Buet, and the third one is our department head of neurosurgery, Professor Dr. Shafiqul Islam, sir. 2 are from DMC, and the next 2 are from Buet. And these are the references, and I would like to welcome any questions on this presentation.
Excellent, Dr. Mobin Ibn Mokbul. a bit scary. Stroke really, many of us even do not have enough information about the sign and symptoms of the stroke. I think your app would make a bigger impact. I have a small question before I open the floor. Uh, Strokes center, how much distributed, or the local doctors, uh, are they connected with your app? Because if they are aware, people first rush to them, local doctor or like that.
So that's a very good question. I'm very much sorry to know that, to inform you that in Bangladesh currently there is no single government hospital that gives 24/7 stroke service. Even in our Dhaka Medical College, we have stroke service, but not that much. Even if you come in at night, you do not have that facilities. Even in NINS, even in BSMMO, we do not have. But in private hospitals, like actually the most expensive one, Square, Evercare, United, you will have 24/7 service. So that's a big concern, and we are trying to make that means an awareness or a connection of doctors, how you can solve these problems. Actually, there's a burning issue in Bangladesh.
Excellent, excellent. Now the floor is open for asking question, comment, or any discussion to Dr. Mobin Ibn Mokbul.
I have a quick question. So this is a very interesting presentation. I'd like to thank you for the presentation. The question I have is that you said the diagnosis is 85% efficient. Now, if patients get the medicine with this diagnosis, what could be the side effect if it's wrong?
Thank you so much, sir. That's a very good question. Actually, we mean the patient, you should go for a hospital. And after going, the hospital should do a checkup, like they will do the CT scan. That's the necessity of hospital. Actually, injection can be done by anyone. I can even inject my medicine, but that's the necessity of a stroke center. And that's why we will not refer to the hospitals which do not have that imaging services. We'll only refer to those who have the imaging services. Then, according to our medical protocols, they will give the treatment. But that notification is important. And I'd like to also add it. There are so many diseases which mimics stroke symptoms, like transient ischemic attack. This is also a disease that mimics stroke symptoms, but it's not a stroke. But this app will show him you have a stroke, but actually it doesn't have a stroke. But what is needed was an international protocol. What they do when they see first facial weakness, arm weakness, speech disturbance, they call 999, I have a stroke. And it is necessary, because I think not delaying is the factor. If they know I have not a stroke, they can happily come to the house from the hospital, and they do not need any treatment. So that's the factor, I think, sir, I have cleared.
Excellent, excellent. I think you clarified well, and obviously this is a beginning. The game change has just been started, and we hope this effort will continue, and the stroke, another deadly disease, we can manage within our limit. Thank you so much.
I have one question. Dr. Mobin, what are your future plan with this app?
Thank you so much. Actually, my plan is to more doctors. First of all, I will try to patent it. We have not yet patented it, because it is launched just 29 October. And after we have patented it, we will try to have some conversation with DGHS, Director General of Health Services. And after that, we may try to disseminate more public awareness, and more people should install it, because if 1 in 4 people will have it, so it is time demanding that we all install it in our mobile phone. And that's our plan.
Excellent. But once you released it and open it, how can you get the patent? Because actually already it is open for all. This is the delicacy, because I handle lots of patent issue.
Sir, actually, it is launched among our colleagues in neurosurgery, but not actually, we did not given any Facebook post or nothing else. We didn't open for general people, but we have launched and neurosurgeons are using it, and we're taking feedbacks on how to develop it.
Okay, thank you. What is important? file the patent and then release publicly.
Yes, sir. Thank
And
you so much.
because the patent office and registration office, they will browse. If they find something same, then
Yes, sir.
they would not
Thank you,
offer
sir.
you the patent. Anyway, thank you so much. I think it was a very important talk as well as good interaction.